Welcome to the new Columbia Orthopedic Group podcast called No Bones About It. And we are lucky to be joined by Steven Newberry today.
Yeah, not sure I would say lucky, but
Come
good
on.
to be here.
He's the guy in charge of our orthopedic urgent care, our ouch clinic, if you will. It started, if I remember, back in May of last year in 2024. And it's grown, and it grew pretty quick, didn't it?
It did grow very quickly. I think definitely quicker than, I can speak for myself, definitely quicker than I expected it to. This all kind of really started back when I was shadowing Dr. Tarbox, back when I was a PA student still. I had a little bit of experience working in an orthopedic urgent care, and so he was kind of bending my ear about what they wanted to do here, kind of along the same lines of getting something started with an urgent care. And so it all started with that kind of idea, that vision that he had. And so I got hired in January. We were able to launch by May 1st was the official launch date. And from there, it kind of, it really skyrocketed.
And let's talk about an orthopedic urgent care, just because it's a little different than, like, you don't want to see sniffles and you don't want to see, hey, I might have the flu. You want to see more orthopedic stuff.
Yeah, definitely. We love trips and falls. We love the ice and the snow that we've been having. You think urgent care and you think, like you said, the sniffles and the flu, and I'm running a fever and my tummy's upset. But yeah, I think what we like to see here is the acute problems. Not that we can't see the chronic knee pain also, but yeah, I think the real service that we can provide is those acute injuries that maybe would have to wait to see a doctor for 2 to 3 weeks, and we can get them in the same day. You don't have to schedule an appointment. You don't have to set anything up. You can just walk in and we'll see you. So.
And there have been a lot of people who have really been using it just, I don't want to say by accident, but some people are finding out about it and saying, wow, this thing is great, and I can't believe that this is here.
Yeah, we get quite a few patients that will just come in and say, hey, I want to get scheduled with Dr. So-and-so. But again, like I said, it's going to be 2 to 3 weeks before they can get in because we got good doctors here and they're all pretty busy. And so they're like, well, you can get that appointment scheduled, or you can come in and see our PA in the urgent care and get evaluated, get some x-rays, get some initial treatment, and still have that appointment with Dr. whoever in 3 to 4 weeks. So,
and if you don't have an appointment already with the doc, it's kind of the first point to get in, because then you guys can make appointments with them.
We can definitely kind of expedite the process, especially if there's a fracture or something that we need to get seen earlier than kind of that schedule allows. We can get them in to see one of the physicians much quicker than kind of any other route. I can walk over while they're in clinic and be like, hey, I got this.
Yes.
Do you want to, are you okay seeing this next week? I think it may need surgery or whatever the case would be. So,
and that's quite a luxury to have here. Not only can you say, do you want to see this, but you can say, hey, look at this, right?
Yeah. It's, obviously this is, I graduated in December of 23 and started here in January of 24. So I've got an ortho background as an athletic trainer and all of that, but this is my first PA job. So having the resources of being able to walk over to Dr. Jones with a hand fracture, or Dr. Bridgman or Dr. Yahweh, and be like, hey, I'm not sure if this might need surgery. Do you mind looking at it? And they've all been really great about, I think that we might need to do something about that. Put them in this splint and we'll get them seen next week. So I think the doctors have helped me kind of transition. And it's always good to have that kind of, that safety net underneath me in case I do see something that I'm not quite sure what to do with.
The other thing, as you mentioned, if somebody walks in holding their arm, holding their knee, whatever, I mean, if it is urgent, it can be taken care of right away.
Yeah, we've definitely done that too, where somebody came in to see, I think it was a hand fracture or a wrist fracture. Somebody came in to see me. We said, hey, I think you need surgery. We'll just transfer you to Dr. Jones's schedule, and he'll do this as your pre-op appointment, and we'll do surgery 2 days from now.
Yeah.
So that kind of quick turnaround doesn't happen often in orthopedics. A lot of times it's you're 2-3 weeks out and I've had a wrist fracture and now there's things that have started to heal and it kind of complicates things. So kind of expediting that process for people has been very good, I think.
If you come in Monday through Friday, you'll see Steven. The other guy I want to talk about is Andy Seaton, who is your right-hand guy, and it like you guys work so well together, and I just want to give him credit because he does a lot of work too.
Yeah, by no means am I a one-man show. I tried. We did a soft launch initially before that March 1st date, or May 1st date. I'm sorry, and I did a few days by myself, and it's too much for one person to do all by themselves. So Andy coming in, he's an athletic trainer as well. As a background, he worked for Central Methodist for a few years. He's got a good history of orthopedics, and so having him to he goes in before I go to see the patient. He gets a good history. He will give me his initial kind of thoughts about what might be going on, and so he has been tremendously helpful in me kind of expediting the process. And I definitely couldn't do it without him. So
the other thing that's nice is he can be in a room and you can be in a room because we all know the hours are 10 to 6 Monday through Friday. And at 10 on a lot of days, you have more than one person ready to see you.
Yeah, it helps that we can both kind of do both jobs. It helps that he can be rooming a patient, I can be rooming a patient. We can both get histories. We can both take people and put orders in. And it helps. We hope that it helps the wait time. Obviously,
Sure.
It's an urgent care. There's going to be wait times, especially our busier days when there's, like you said, a log jam of people to start out the day. But I think we do a good job of kind of definitely quicker than ERs or other options that you would have. And so I think obviously we're still trying to grow and still trying to improve that. But I think we do a good job, and us both being able to do that job, I think, helps that.
I think one of the things that maybe people don't know is if there is a wait, it's not very long. Like usually, and maybe I'm speaking out of turn, but usually I think it's under 30 minutes.
Yeah, I mean, I think we certainly try to get people in and out within an hour or so, and that's from check-in process to bringing you back to the room, to getting a history, to getting x-rays, to me seeing you, to getting your treatment, medications, or whatever we're doing for you sent and getting you out. So I think we kind of shoot for that hour mark. If we can get people in and out within an hour of that whole process, I think that's pretty good.
Okay, so it opened up and was Monday through Friday, 10 to 6. Now we've added Saturday hours because you guys were so busy.
Yeah.
So Saturday, 8 to 12 is a big thing too, especially like we saw during the fall. Friday night, something happens, you can come on in.
Yeah, I think that's a great resource for obviously people that are working, that 10 to 6 may not work for their schedule. As you said, the Friday night football injuries, I think that's been great for us as well. I think local colleges have used us quite a bit for referrals of, man, this has been going on for a couple weeks. Let's get some x-rays and make sure there's not something else going on. And so I think the Saturdays have really opened up to a new demographic of people that maybe the Monday through Friday 10 to 6 doesn't necessarily work the best for. And so I think it just it helps us open up to more people. I think accessibility is really what we're working for.
And like you said, lower wait times, and if you can get in, where do you want to see this like go from here?
Yeah, it's so new, right? We're not even a full year into it at this point, and I think the growth, at least speaking for myself, has been more than I could have expected this early on.
Yeah,
and we did a little bit of market research and talked to orthopedic groups in Kansas City and Des Moines and a bunch of different locations, and everybody says you're not going to do well that first year. It's not going to be a fruitful endeavor, but you're still helping people, and that's what the ultimate goal is. But I think here it's been much more than we expected initially, at least myself. And so I think obviously we're just scratching the surface of what I think that we can do. Where we go from here, it's tough to say. Is it more locations? Are we spreading out? But I think all things are on the table at this point, given how successful it's been so far.
All right, let's talk about you now. What got you into orthopedics and, athletic training and stuff like that?
So I did my undergrad at Benedictine College. I played football out there for a few years.
You're obviously a lineman.
Yeah, I was a linebacker back in the day. I was a little bit bigger, but linebacker back in the day. Got recruited to play football there, a small NAIA school in Atchison, Kansas.
Yep.
So went out there, had no idea what I wanted to do in terms of my future, other than I liked football and I wanted to play football. I got hurt playing football. Was told that it's probably not a great idea for you to continue to play. And so obviously being hurt, I was in the training room quite a bit.
Yeah.
And so that is kind of what introduced me to athletic training. And I was like, so you're telling me I get to be around athletes, I get to be around sports, I get to watch football games.
Yeah,
and
right.
I get paid for it? That sounds good to me. And so I got into that. Similar to the athletic training, I wasn't really sure what a PA did. But again, being hurt, I got to interact with the team physician for Benedictine College and his PA. Corey Schrick is his name. He works with Brett Miller and St. Joe. And so I got to work with them pretty closely. And I was like, this is pretty cool. Maybe I want to do this.
Yeah.
And so did the athletic training route. I liked it. I enjoyed it. Hours weren't great. So I did... After I graduated, I was a GA for the athletic training program at Benedictine for 2 years. I got my MBA, my Master's of Business Administration. So got 2 years of work experience, got to do some prereqs for PA school. Again, as I said, the hours aren't great. The pay as a GA wasn't great. And so I was like, maybe a clinic setting would be better. So initially getting into athletic training back in the day, there wasn't as much clinical athletic training opportunities as there are now. And so it wasn't much of an option initially, but after a while, as I said, I went and did the clinic setting in an orthopedic urgent care in Kansas City. Did that for a couple of years. That allowed me to take prerequisites for PA school and kind of get good patient care experience. It taught me a lot of casting and splinting techniques and just gathering a history. It taught me a lot. And so I was lucky enough to get into PA school after that, and that's kind of the whole journey.
And when you were at the urgent care in Kansas City, the hours sort of regulated, right?
Yeah. So the hours out there were 3/12s. You worked 3 days a week for 12 hours a day, and you had 4 days off. And so that schedule really allowed me to do other things outside of work, classes.
Study.
Yeah. And so, I think that obviously that was a good work experience for what I'm doing now. I think we have taken a lot, at least I have taken a lot of what I learned out there and what worked and what didn't work, what I thought could be done better. And so, everything that you do in life is kind of an opportunity to learn and grow. And so that's kind of what I've tried to do.
One thing I want to just touch on right before we end here is, again, what you want to see. You see broken bones,
Sure.
You see sprains, you see trips and falls, not necessarily colds and flu.
Sure.
And then the other thing is, do you want to see chronic pain, or is that better suited to see somebody like Dr. Newton or, a back doctor, or.
So it's tough, right? Like, obviously, you get into this to do like acute injuries, but there's people that have chronic pain, as you said. And so I think that while it's not it's not an urgent injury, I think that it's still an avenue to get people in the door and get people seen and evaluated and some treatment before they have the opportunity to see a doctor. And so I think obviously the sports injuries and things like that, older patients as they need treatment as well. Yeah, I think it can be a good avenue. So
I can speak from experience.
Yeah,
accidents happen.
The weekend warriors and all of that. I think it's not just high school athletes that get hurt. I think we can be a benefit to the Columbia community through numerous ways.
You know, we talked about football, but we failed to mention once you get into spring and the weather starts getting better, then you have the adult softball leagues and the kickball leagues, and you're going to kids' things, and things are going to happen. Once the weather gets warm, we get busy.
I can't tell you how many pickleball injuries we have.
There you go.
Yeah, I mean, it's like I said, the weekend warriors and the people that are just getting out, you don't think something's going to happen, but it's a good way to get people in the door. Like I said, I think accessibility is the big thing that the best thing that I think we can provide is we're opening a gateway, a path for people to get in and get seen, and that they don't have to wait a week or two to be seen by a physician.
And that's what some people said about Columbia Orthopedic Group in the past was you had to wait. Well, now you can walk right in.
Yeah,
I mean, that's the big deal.
Yeah, people are surprised. I don't need a call. I don't need an appointment.
Right.
I just walk in and tell them I'm here.
Yep. And that's absolutely right. And the Ouch Clinic is open here at Columbia Orthopedic Group on 1 South Keene Street. And it's Monday through Friday, 10 to 6. And it's Saturday, 8 to noon. And if you come during the week, you'll see this guy.
Yeah.
Steven, thanks for the time.
Yeah, no problem. Thanks for having me. It was good.
Yeah, you bet. Thanks.